Emergency departments in hospitals that deal with the unexpected.
That's right, Chris. All over the UK, there are expert teams ready for action.
We're on call with the UK Emergency Services, showing you what it's really like on the front line, saving lives.
This is a rapid response car. It's one of a fleet of vehicles that respond to up to 3,000 emergencies a day here in the West Midlands. Time to find out what it's like to be first at the scene of a medical emergency.
If you have an accident, this fast medical service is ready to help 24 hours a day.
So I've got my camera, Eric's in the back with his camera. We're going to get you as close to the action as we can. On call with me is paramedic Xand. She can do 20 emergency call-outs in a day. And a new case is just in. So at the moment, all we know is that 3 children have been involved in a road traffic accident, in a car crash, and that they've been taken home, but there's still some ongoing problem. We don't know any more than that yet. We need to get there and have a look. And just minutes later, we're at the house. Inside, there are 2 children, Annie and Ryan, waiting to be checked over. When did you notice that you had pain in your head?
I banged my head and it started hurting when I was in my dad's car on the way back.
So you didn't notice it immediately?
No.
Yeah, it's strange, isn't it, that you hit your head and you don't notice it, you're so surprised, and then later on it starts to hurt. After an accident, it's important to get checked over.
Try and pull me towards you.
Either by a medic, a doctor, or at your local A&E, as some injuries take time to appear.
So you've got a little bit of a headache? Yeah. And has that headache got any worse, or has it stayed the same?
Sort of the same.
Sort of stayed the same.
So what Jan's doing now is making sure that Annie and Ryan haven't got any other injuries which are a bit harder to find.
Push and pull down. Brilliant. Gosh, you're strong, aren't you? Do you go to the gym?
So she's checking their strength to make sure that their nerves are right, she's checking their hands and their arms.
Feel me touching you? Feel me touching you?
And she's checking the nerves coming out of their brain, she's checking eyes and mouth, things like that. But so far, everything looks really good. But it's really nice that Jan's able to get here quickly, assess them at home, and hopefully spare them a trip to hospital and any more investigations.
Well, that looks absolutely fine, so that's good.
Did you have any pain in your neck or anything like that?
It ached a little bit, but it was fine.
And are you feeling all right now? Okay, good.
They could, over the next couple of days, get some stiffness in their neck, which is called whiplash, which happens after an accident. Right, this is paracetamol, OK. And as long as there's no worsening headaches and there's no confusion and no vomiting, then they should be fine.
So Jan's checked out Ryan and Annie, and they're both really well, and they're sitting on the sofa comfortably, and a lot of that is because they were both wearing their seatbelts. It's a really good result.
And if you ever have a medical emergency, there are hundreds of similar crews on standby around the UK, ready to help.
In the UK, there are hundreds of rapid response medical teams on standby.
And they have to get to the scene of an emergency in minutes.
We're on call with the UK Emergency Services, showing you what it's really like on the front line saving lives.
This state-of-the-art rapid response vehicle can get to the scene of a medical emergency in minutes. And today, I'm going out in it to show you what it's like to be a life-saving paramedic.
If you have an accident, this fast medical service is ready to help 24 hours a day.
We never quite know what we're going to find when we get there, but I've got my camera, and of course, Eric's in the back with his. So we've got it covered from all angles. On call with me is paramedic Xand. She can do 20 emergency call-outs in a day. And a new case is just in. We're driving toward the emergency, and the call is still going on. And it's just come in that it's a 75-year-old man. Jan is the first medic on the scene to see Don.
Hello, Donald. Have you got any pain anywhere?
In the hip.
Right, we need to try and get you onto your back a little bit so that I can assess whether we think you've broken it or not. Right, I'm going to pull on your trousers.
It's clear Don's had a nasty fall, and to make him more comfortable, Jan wants to move him onto his back.
Give us your arm then, sweet, so I can do your blood pressure. Are you happy to go to the hospital today and maybe get that x-rayed, yeah?
To help Don with his injury, Jan gives him some pain relief.
This goes over your face and you breathe it in and it makes this funny noise.
Go on, have some nice big breaths.
Don's getting some Entonox, also known as laughing gas.
That's the hissing you can sound. So he should start feeling like he's in a bit less pain.
I've called for an ambulance to back us up, so we're going to get him into the hospital, get him an X-ray on his hip. We think he may have broke it, so we can't treat that at home. He needs to be seen at the hospital.
With a suspected broken hip, the ambulance crew arrive with some special equipment.
The ambulance team are using a really cool piece of kit called a scoop, and it comes in 2 halves, which you can slide together under the patient and meet in the middle, and then it's like he's on a bed. They can just pick him up and scoop him straight to hospital.
Don, how do you feel?
A bit easier now.
A bit easier, good.
Ready?
Ready, set.
Jan did a great job helping Don with his pain and making him more comfortable.
Now he's off to hospital, they'll x-ray him and see if they can do anything to treat the cause of that pain, his hip.
And if you ever have an emergency, there are hundreds of similar crews around the country ready to help.
There are emergency teams standing by, ready to help you. And they need to get to the scene of an accident fast.
We're on call with the UK Emergency Services, showing you what it's really like on the front lines saving lives.
The West Midlands Ambulance Service is on standby all day, every day to respond to emergencies. I'm hitching a ride in this rapid response vehicle so you get to see up close what it's like to be first on the scene.
If you have an accident, this fast medical service is ready to help 24 hours a day.
I've got my camera, Eric's in the back with his camera. We're going to get you as close to the action as we can. On call with me is paramedic Xand.
This service takes thousands of 999 calls and a new case is just in.
We've been called to someone who's choking. Now, if they're really choking, they won't be able to breathe. So this is a real emergency. We have to get there as soon as possible. The screen tells us they're older than 16 and they've got a carrot stuck in their throat. That's all we know, but that's enough.
A fast response can save lives, and paramedics like Jan are often first on the scene.
It's only taken about 5 minutes to get here to see James. How are you feeling, James?
Oh, I'd be feeling much better if we could get rid of this carrot out of my throat.
He's not choking, but he can't swallow. And as James is diabetic, this could be really dangerous, because if he can't eat, his blood sugars are going to be affected, and that can be life-threatening.
So poor James has got a bit of carrot stuck in his esophagus. That's the tube going from your mouth to your stomach. It's causing him real problems now.
Because he's not able to swallow, his blood sugar is getting low.
2.5.
He's in real need of something sweet.
Right, and what I'm going to get you now is that sugary gel, just to see if we can get your sugar levels up a little bit, OK?
It should just absorb through your skin in your mouth, so you don't have to swallow it.
Yeah, it's gone.
And now that's done, what about that carrot?
He'll need to go to hospital and have it surgically removed. It's not a big operation, it just involves putting a tube down his throat and removing the blockage while he's been sedated.
Jan's job done, it's now safe to transport James to hospital by ambulance. Bye, James, take care. So that's a really good result for James. It'll be quite easy to get that blockage out of his throat in hospital. But if it hadn't been done, and if Jan hadn't been here, his blood sugars would have got dangerously low and he'd have been in real trouble. But he's not, thanks to the paramedics. And if you ever have an emergency, there are hundreds of similar crews around the country ready to help. We're on call with the UK Emergency Services, showing you what it's really like on the front line saving lives. This is a rapid response car. It's one of a fleet of vehicles that respond to up to 3,000 emergencies a day here in the West Midlands. Time to find out what it's like to be first at the scene of a medical emergency. On call with me is paramedic Xand. She can do 20 emergency call-outs in a day. And a new case has come in. So we've been called to see someone with diabetes. We don't know exactly what the problem is yet. Their sugar could be high, it could be low, there could be something else going on. But what we know is we need to get there quickly. Moments later, we arrive at the house.
Hiya.
Inside, the man Tony is having some problems with a medical condition called diabetes. That means his body doesn't produce a chemical called insulin and his blood sugar levels get out of control.
I've woke up this morning, I've got a blood sugar of 20.
Okay.
Checked it an hour later, it's still at 17.
Okay.
Done another 10 units each arm, and it's dropped down to 1.4.
Okay.
So Tony's very sensibly called the paramedics because his blood sugar is too low. The problem is, earlier in the day it was too high and he took insulin to bring it down, and he's taken too much insulin and he can't get it back up again because the insulin's still in his system and working.
Once your heart and your blood pressure and that have been checked out and they're fine, I can pop a little drip in your arm and give you some glucose fluids.
Tony's heart and blood pressure look fine.
I feel actually a lot better than I did when you came through the door.
Good.
So Jan can now help boost his blood sugar levels by giving him a sugar called glucose.
He's not able to eat at the moment and he's vomiting when he does eat, so he can't maintain sugar levels by himself. So that's going to raise his sugars up, hopefully enough that he can cope at home. If it drops again, then he'll have to go to hospital.
8.7.
Get some food down, yeah, please.
As Tony's blood sugar levels return to normal, he can hold down food and start to manage his diabetes on his own again.
When it's really severe like it's been today, then you need a little bit of external help.
So when we arrived, Tony's blood sugar was dangerously low. Now he's much more relaxed and crucially he's safe and he hasn't had to go to hospital, and that's all thanks to the emergency services. With hundreds of rapid response crews in the UK, if you have an accident, an emergency service like this won't be far away.
It's not only teams in hospitals that deal with medical emergencies.
All over the UK, there are teams of paramedics on standby, ready to help. We're on call with the UK Emergency Services, showing you what it's really like on the front line saving lives.
Paramedics use state-of-the-art vehicles like this to respond to medical emergencies within minutes. And today, I'm going with them to see what it's like to be first on the scene. Yo! On call with me is paramedic Xand. She can do 20 emergency call-outs in a day.
And a new case has come through.
So a call's just come in about an 83-year-old woman with one of her legs swollen. So we need to get there as quick as possible. Following a fall 3 days ago, Doreen's leg has swollen up and she's not been able to leave the house. Her daughter is concerned something serious could be wrong.
We need to see if that knee needs draining. It's quite swollen, isn't it, in comparison to the other one?
To have her leg properly looked at, she'll need to go to hospital.
5157, can I have Amber back up, please, Eva? So I'll arrange for an ambulance to come and pick you up. I'll do your blood pressure and...
the air and everything.
You look gorgeous, Doreen. You look gorgeous.
Have you had any clots before?
No.
No.
Not so I know of.
One of the main things I think might be going on is she might have a clot, which can happen in older people. And in her legs, that doesn't cause her too much problem, but it can be dangerous if it moves from the legs and goes to the lungs.
With the ambulance on its way, we have time to do some important tests that will help the hospital when Doreen gets there. Doreen, this is a tracing of your heart, and you can see it's nice and regular.
That's something's right.
All the lines are the right way up and the right height, and they look fine.
This is Doreen. Had a fall on Saturday. Pain in her left knee with swelling. Left lower leg.
The ambulance crew have arrived and Doreen's in great shape. She's really cheery, but she has got this knee pain, so we need to get her to hospital, fix the pain, and then she can come home again.
We've got what's called a striker chair to get Doreen downstairs on, and it's a special design chair that has runners rather than wheels, so it could slide down the stairs.
What do you think of this, Doreen? I've never seen one of these before. I might get one myself. Doreen's an amazing woman, but today her leg's a bit swollen. She can't walk around as easily as normal, so she's going to get to hospital. And luckily, when she needed help, Jan and the amazing chair were here to give it.
With hundreds of rapid response crews in the UK, if you have an accident, an emergency service like this won't be far away.
It's not only emergency departments in hospital that deal with the unexpected.
That's right, Chris. There are expert teams all over the UK ready for action.
We're on call with the UK Emergency Services. If you have an accident, an emergency service like this won't be far away.
Paramedics use these state-of-the-art vehicles to get to emergencies in minutes. And today, I'm going along to see what it's like to be the first at the scene.
This fast medical service is on standby, ready to help 24 hours a day.
Never know exactly what we're going to see when we get there, but I've got my camera and Eric in the back has got his. So we're going to get right up close and see what's happening.
On call with me is paramedic Xand. And a new case is just in.
So we've just got information. This is a 40-year-old woman. She's got chest, upper back pain. The most important thing we're worried about is a heart attack.
Xand grabs her gear and gets inside.
What's been happening, Tanya?
Oh gosh, I had gallstones removed. The same pain.
The same pain as what you had before?
Same pain.
Let's give you some gas in here so we can try and get you a bit more comfy.
Tanya's quite distressed, so Xand gives her some pain-killing gas to help. It doesn't look like it's her heart, and it may be related to an old problem.
So Tanya's previously had gallstones, which are stones in a part of your body called the gallbladder. And the gallbladder secretes stuff into your gut that helps you digest food. And if it gets blocked with stones, it can be intensely painful.
The only difference is it's in my back and shoulder as well.
So this time it feels a bit different to her gallstone pain, and the ECG confirms her heart is fine.
There's an ambulance on its way, all right.
But Tanya's going to need to get this new pain investigated in hospital.
So while we're waiting for the ambulance to come, I'll try and get you comfy.
And because she's in some discomfort, Xand decides to put painkillers directly into her bloodstream.
Right, that should start having a bit of an effect soon.
Finally, she's now able to make her own way out to the ambulance with her pain under control.
So Tanya's biggest problem was that she was in a huge amount of pain. Luckily, Xand showed up with some reassurance that it wasn't her heart. She's off to hospital, but they'll be able to get to the bottom of exactly what's going on.
And if you ever have an emergency, there are hundreds of similar crews around the country ready to help. If they can't fix you at the scene, they'll get you straight to a hospital for more treatment.
Over the UK, there are emergency teams standing by, ready to help you.
And they need to get to the scene of an accident fast.
We're on call with the UK Emergency Services, showing you what it's really like on the front line saving lives.
This is a rapid response vehicle. It's on standby 24/7 to respond to whatever emergency calls come in. Today, I'm going along for the ride and you're coming with me. On call with me is paramedic Xand. She can do 20 emergency call-outs in a day. And a new case is just in. We're going to see someone who's got a very severe cut on the head and they're refusing to go to hospital. Now, the reason we don't have the sirens on or the blue lights on is because they're with an ambulance crew at the moment. But Xand is the only person on call at the moment who can glue his head together, which is what we're going to try and do. At the house, the man, Paul, is in good spirits despite the nasty gash to his head.
Thanks for coming out at such short notice.
It's all right.
As a paramedic with 10 years' experience, Xand has the expert training needed to use special glue to join Paul's wound together.
Right, this glue might sting a little bit, OK?
How's that feel, Paul?
Can't feel anything.
Not stinging. Good.
The super glue that Xand's using now will hold that wound closed. It doesn't need stitches, and it stops the bleeding. It'll stop infection getting in, and it gives a nice result. It gives a tidy scar.
All large head wounds should be seen at a hospital, but Paul has refused to go, so Xand gives him some advice.
Any headaches that aren't controlled with painkillers will need to be assessed at the hospital. Vomiting more than twice will need to be assessed at the hospital. We have got a slight issue.
What?
My fingers are stuck to your head. No, not really.
Xand has done all she can for Paul, and it's up to him now to be vigilant and spot any side effects.
See you then.
Take care, see you later. Bye.
Bye.
See ya. So even though Paul didn't want to go to hospital, we were still able to glue his head together. That stopped the bleeding, it reduces pain, it reduces the chances of infection, and we've given him some really clear advice about what to do if he gets worse and he does need to go to hospital. And that's all thanks to Xand.
With hundreds of rapid response crews in the UK, if you have an accident, an emergency service like this won't be far away.
We're on call with the UK Emergency Services, showing you what it's really like on the front line saving lives.
The West Midlands Ambulance Service is on standby all day, every day to respond to emergencies. I'm hitching a ride in this rapid response vehicle so you get to see up close what it's like to be first on the scene. On call with me is paramedic Xand. She can do 20 emergency call-outs in a day. And a new case is just in. We've been called to see a 44-year-old lady, and at the moment the suspected diagnosis is a stroke. Now that means that she's potentially got a blocked blood vessel in her brain. If you act quickly, you can get a much better result than if you wait. So we need to get there fast. Minutes later, we arrive at the address. Inside, Jotty is in shock. She's lost feeling down one side of her body and has no idea why.
And suddenly it started going all numb.
On the left side of your face, okay.
And then I started going down, and my husband pulled me back up.
So you started slumping in the chair, did you? Yeah. I'm going to do a few checks on you. If it is something serious, like if it is a stroke, which obviously we're all concerned about, it can be managed and it can be treated, okay?
So Jotty has high blood pressure and she's got diabetes.
Normal then?
And both of those things make having a stroke a little bit more likely.
Can you feel me touching it?
I feel that side.
Can you not feel this side?
Not much, no.
So what Jan's doing now is assessing how well Jotty's nerves in the brain are working. And all that will tell us whether or not there's a problem in her brain and how quickly she needs to get to hospital.
This numbness in this side of the face is not normal. So I would like to get you checked over at the hospital just to make sure that it's not like the start of anything like a stroke.
So one of the most difficult parts of Jan's job is not just making medical decisions, but also dealing with people, trying to persuade people who are frightened of hospitals that maybe it's a good idea to go in, trying to explain to people what's wrong, and that's what she's doing there.
What I'll do is I'll arrange for the ambulance to come, but I'm going to stay with you the whole time, OK? 5157, just amber back up, please.
By the time the ambulance crew arrive, Jotty's mood has lifted, thanks largely to the expert care she's received from Jan. She even manages a little joke.
Why do you think you're feeling better?
See two handsome men like you.
Is that what it is? Yeah. Oh, don't make their heads any bigger than they already are.
Are we going to the opticians?
Oh, here we go. There we go.
So Jotty's now in the ambulance and she's about to go to hospital where she'll get the treatment that she needs. She's laughing and joking, she's much more relaxed. It's a really good result for the emergency services.
You did fine.
We're on call with the UK Emergency Services. If you have an accident, an emergency service like this won't be far away.
In the West Midlands, there are over 3,000 emergency calls per day, and this is one of the high-tech vehicles that responds to them. Today, I'm going along for the ride.
If you have an accident, this fast medical service is ready to help 24 hours a day.
We never quite know what we're going to find, so I've got my camera with me, and of course we've got Eric in the back, so we're going to get as close as we can and find out what's going on.
On call with me is paramedic Xand. And a new case has come in.
So we've just got a call about an 85-year-old man with chest pain. It sounds like he was unconscious, but he's awake again. So we're going to get there and see exactly what's happening.
We get there quickly, grab the gear and head in to find the patient, Eric.
Hello. Hiya. Eric, do you get this pain often?
I never had it like that before.
Because Eric is experiencing a severe chest pain, Jan immediately hooks him up to a specialist piece of equipment.
So Jan's just doing an electrocardiogram, so she's doing a measurement of what's going on with Eric's heart. We've turned up and he's had chest pain and he collapsed and he's covered in sweat, and sometimes that can be a sign that someone's having a heart attack.
The electrocardiogram analyses Eric's heart rhythm and lets Jan know if it's beating normally.
OK, that's fine. What we need to do is we need to get you into hospital, get some blood tests done so they can check for some enzymes in your blood.
Eric's in no immediate danger as his heart rhythm is normal, but he needs further tests in hospital to see if he has actually had a heart attack.
Now I see this spray's with you. Have you been using that this morning?
Yeah.
Jan spotted some heart medicine spray that Eric's used twice today.
That's probably what's caused you to collapse, because it drops your blood pressure, that spray.
It looks in this case like, rather than having a heart attack or something really serious going on, it seems like he just had a bit too much of his heart medicine.
So Jan seems to have solved Eric's problem. But the paramedics will still need to take Eric to hospital to be extra sure nothing is going on with his heart.
One of the nicest things that Jan has done here is been able to turn up, reassure everyone, find what seems to be the real cause, and now we'll just take him to hospital, make sure that nothing more serious is going on, and he can come back.
All the best, Eric.
And if you ever have an emergency, there are hundreds of similar crews around the country ready to help.
If you have a medical emergency,
There are teams of paramedics all over the country on standby, ready to spring into action.
We're on call with the UK Emergency Services, showing you what it's really like on the front line saving lives.
This is a rapid response vehicle. It's on standby 24/7 to respond to whatever emergency calls come in. Today, I'm going along for the ride and you're coming with me. On call with me is paramedic Xand. She can do 20 call-outs in a day. And a new case is just in. We've just been called to an emergency and we know it's a man. They've fallen in the garden and they've got blurred vision. Minutes later, we arrive at the scene. And just as we get there, the man, Peter, falls again.
Right. Darling, you need to keep still for me. Well, at least you're laughing. God, you just give me the fright of my life.
It's stupid, this.
Joking aside, Jan quickly gets him sorted and makes an immediate assessment of his possible injuries.
Squeeze me. Not too hard. I need my fingers afterwards.
He can do some things well, but there's a problem.
I can see about half of you. The rest has disappeared.
Peter's not seeing properly.
The thing that we've got at the minute is his eyes aren't moving together. They're moving separately. So we need to find out why that's going on. OK. Right, look at me. Shine a little light into your eyes.
So what Jan's just done is had a look at how the nerves in his head and face are working. We want to see if he's had a stroke, if he's had a blockage in a blood vessel to his brain, and that may have damaged a little bit of his brain, which controls his eyes.
A stroke is worrying because it's potentially life-threatening, but then things change again.
Yeah. I can see.
Follow your pen again. Keep your eye nice and still. Keep your head still. Follow the pen.
Peter's symptoms seem to be improving.
And that shed looks like it's in the right position again.
His eyes are together now. Initially, they were separate.
They were miles out.
It's taken about half an hour from when his symptoms started to going away again. It's just about completely gone. And that does suggest that it's likely to be what we call a mini stroke. And what's good about a mini stroke is they do get better, but they do suggest you're at higher risk of having a bigger stroke.
And a bigger stroke could be more serious.
The danger of that happening again is there at the minute, so we'll get him checked over.
So it's an ambulance for Peter.
I'm not sure he's at... Whoop, whoop,
Right, steady, steady, steady.
He's still very unsteady, but it's vitally important that potential stroke victims are checked over as soon as possible.
Good luck, Peter. So what Jan's able to do really well there is examine Peter, figure out where he needs to go to get the best treatment and get him there quickly. It's what the emergency services do really well.
With hundreds of rapid response crews in the UK, if you have an accident, an emergency service like this won't be far away.